Whether my screen is visible to all of you?
Yes, sir.
Yes, sir.
Yes, sir, it is visible.
Okay. So, very good afternoon to all of you. Please mute your mic, all of you. Okay. So, very good afternoon to all of you. I'll be talking on these two topics today: ethical considerations and intelligent computing pipeline in healthcare. In the first session today, you have got the idea of what is intelligent computing, and in fact, you have gone through a very state of the art technique that is called as deep learning, and other applications. Some of the recent applications in which Lode sir is working, you have gone through these things. Okay, so in the second session we'll be talking about the ethical considerations and the actual intelligent computing pipeline, because what I have seen, or what our team has seen, is that many of the participants, they are from the medical field, and many of you are from engineering field. Some of you are senior, means having a good amount of experience, and some are young also. So that's why we thought that it will be good initially to discuss the intelligent computing pipeline. It will give you a complete picture of how the intelligent computing process goes step by step. And I'll be talking about ethical considerations also, though I feel that I'm not an expert to talk about ethical considerations. I think many medical professionals are also in this workshop. They might be knowing it much better than me, but because this is a healthcare workshop, our team felt that this topic, at least putting this topic or discussing it in brief, will be important, because when many of you get into this field after getting inspired from this workshop, you must know that before initiating any health research, what at least some minimum considerations are there which you must keep in your mind. Okay, so I'll be talking in very brief about the ethical considerations, not much detail, and then mainly I'll be talking about the intelligent computing pipeline in healthcare. So part one of this topic is ethical consideration in research. So I want to put a disclaimer here that most of the contents of my presentation are taken from different sources like internet and books. I sincerely acknowledge all these sources, and I have no conflict of interest in these topics. Okay, so what is ethics? Okay, so as a biomedical researcher, I'm a biomedical researcher. In fact, most of the people in my team, like Dr. Mridu and our PhD students, we all are working in some health research. Okay, and whenever we are working in health research, it means that we are involving human participants in our study. Okay, so human participants or animal participants, so we all are including such participants in our study, and that's why ethics come into role. So ethics is a way of understanding and examining what is right and what is wrong, because if I'm designing a study which will be performed on human participants, I must analyze that whether I'm doing justice to them, whether I'm doing justice to nature, whether I'm doing justice to the research or the research field or not. Okay, so that's why ethics is important. Ethics is actually in general, not only to the health research. When it comes to health research, we call it as bioethics. We call it as bioethics. It is a way of understanding and examining what is right and what is wrong in biomedical research and practice. In general, ethics is the term which is used in all the fields of research. Either it is information technology, or it is computer science, or it is electronics. In any field, ethics is important. Ethics is not only related to human research or animal research, it is also related to what you do, means what kind of study you are doing, what kind of results you are giving in the journal publication, whatever results you are presenting. So how much it is correct, it is not fabricated, and how you are conducting your research, whether it is conducted in a faithful manner. So a lot of things are there in ethics, but we'll be currently talking about bioethics and why ethics is important in human research. So basically, as I told you that I'll be discussing this in very brief. So research ethics principles are broadly divided into three categories: respects of persons, because mainly we'll be acquiring data from human participants. So respecting them, what are the constituents in respect, that will come later on. Then we have beneficence and non-maleficence, and finally justice and non-exploitation. So these three are the main, you can say broadly, these three are the main principles which are involved in research ethics. So when we say respect for a person's, because when I take a data from the human participant, the participant is free to give or to not give the data. The participant is free to refuse to give the data. Okay, so what does the autonomy indicates? The autonomy or the right of the person indicates that the individual is unique and free. The individual is not bounded to compulsorily give us the data. The individual has the right and capacity to decide, and every individual has value and dignity. Every individual should be treated in equal manner. Everybody has value and dignity and has a right to informed consent. We'll talk about informed consent in detail in the coming slide. Okay, so we have to respect every individual who is either participating or has anyway involved in our research protocol, and particularly for vulnerable persons who are having some kind of deficit or who are specially abled or having some problem, we have to also take special protection for such kind of persons. For example, if I'm taking data from especially abled or people suffering from some kind of mental disorders, then it is compulsory that there should be some paramedical staff or nursing staff should be present while I'm taking the data, especially when I'm saying I'm an engineer. So only on that perspective I'm talking. Obviously, when the data is taken by the expert clinician, the scenario may be different. But as an engineer, I'm talking that when I'm taking a data of some such kind of person, then presence of some clinician or at least a paramedical staff or nursing staff is important. The second point was beneficence and non-maleficence. It means that the protection of the study participant is of most important responsibility of the researcher. Okay, so when I say protection, what does it mean? Protecting the physical, mental, and social well-being of each research participant. When you are taking the data, the research protocol which you are using for taking the data, that must not affect the physical, mental, and social well-being of participants. So the data recording and the use of data should be completely anonymous. The identity of the patient or the identity of the individual must not be disclosed in any way. It minimizes the physical and social risks. So that's why whenever a research protocol is prepared in such cases, the risks are always predefined, that what would be the possible risks to the participants or the individuals. Okay, so the risks should be minimum and the benefits should be maximum. Like for example, most of the imaging modalities like CT or X-ray, they involve a lot of radiation. Okay, and it is not recommended to unnecessarily undergo these imaging modalities. But still, why they are used in medical field? Because the advantages or the benefits of these imaging modalities are so much, the benefits are so high that this drawback and the risk is so low. So that's why they are used in the medical field, because the risks are not that high and the advantages or the benefits are very high. So basically, the result should generate more good than a harm. This is very important. The research should generate more good than a harm, and risks of research should be reasonable in light of expected benefits to the individual and the society. Extremely sorry, I'll just have water. So that's why whenever I'm preparing my research proposal, the research proposal should also include the risk-benefit analysis, that what will be the possible risk to the participants or the individuals and what will be the benefits. And high benefit, low risk model is only desired or only appreciated. The third important principle in Ethics is justice or non-exploitation. Basically, the whole research protocol and the whole process of data collection should be fair. We cannot select individuals as per just to fulfill some requirement or just to have some publication. So even the selection of participants is to be done in a very fair manner. The research should not be done in a community that is not likely to benefit from the result. Okay, I want some speech data. So if I want the speech data of, say, persons with respiratory disorders, I cannot take the speech data of any other subject just to have increase the number of samples. Conduct equitable recruitment of research participants. Sufficient number of research participants. When you are presenting your results, we should clearly state that on how many samples this research study is verified, and the calculation of sampling size and everything should be done in a predefined manner. When I say predefined manner, it means that there are some rules to select the sample size. Those rules should be followed while selecting the sample size. Okay, and again provide special protection for vulnerable groups. So these are the three main principles which are important in ethics, and to govern all these principles and to take the decision that whether the research protocol which you have designed or whether the research proposal which you have designed, whether it is further recommended or not, which is to be recommended or not, there is a committee which is called as International Review Board or Independent Review Board. We also call it as Institute's Ethics Committee or Institutional Ethical Committee. So a lot of names are there. Okay, so there is a committee which is constituting of 5 to 10 members. Extremely sorry. There is a committee which is constituted. It consists of 5 or 10 members, and it consists of doctors, scientists from medical field who are not doctors, social workers, means the scientists from sociology, and some common people. So they are also the part of that committee, and then they take the decision that whether the research that is presented, the proposal that is presented to them, should go further or not. Okay, so this is so most of the institutes who are involved in health research, they have institutional ethical committee, and the permission of institutional ethical committee is must before proceeding in any kind of health research. Health research means whenever you are involving any kind of human sample or animal sample. Okay, and then a very important thing in human studies is voluntary informed consent. Means whenever we are taking data from some human subject, then informed consent must be taken. What is informed consent? Informed consent basically means that you should it is a documented thing, and in which you verbally as well as in written you explain the whole research protocol to the individual or the patient from which you are taking the data, and you explain him or her the risk, the benefit, and then the patient has to decide that whether he is interested in participating in this study or not. So that's why it is voluntary, it is not forced. So what does it involve? What does the informed consent involves? It involves the complete research description. What is the study about? What will be the procedure? Who is sponsoring the study? What will be the risk of participating? Risk to the individual. What will be the benefits in the population of the individual? Okay, assuring that the data of the participant will be completely confidential and it will be used only for academic and research purpose. Compensation for time, travel, and possible harm. We can compensate them. We can we can help them in some financial manner, or if they're coming from some distance apart, we can give them travel allowance or something. So we can definitely give some allowance also to the participants. We have to give contact numbers to the participants, because whenever if they have some questions or they have some concern, maybe after the day of recording, they may feel something, so they can have some concern. So the consent form also includes the contacts. Okay, and then They have a right to voluntary participation and also to withdraw from the study at any point of time, at any point of the time of the whole study. Also, the adequate understanding should include that the difference between research and healthcare are related concept, therapeutic misconceptions. So basically, it is also important that research and healthcare are related, means the research on healthcare and healthcare, they are related, but it doesn't mean that whatever study I am doing and whatever finding I'll get, that will be directly applied in the field of, in the medical field. Obviously, a lot of standard procedures are there, like clinical trials and other things which are needed. So if I'm giving some result, it does not mean that it is completely true and it is immediately applicable in the clinical field. After thinking seriously about the information, the person can arrive at the decision without being forced, threatened, or offered something so valuable that is free choice is impossible. Okay. And obviously importance of language is there. If I'm doing, like I told you, if I do speech analysis, and there may be a possibility that subject, what kind of subjects I'm choosing, whether they are Hindi speaking subjects or English speaking subject or Chhattisgarhi speaking subject, because that language accent will come, their mother tongue language will come in the Hindi. Suppose if we are taking Hindi, so that accent will also affect the language. So importance of language is also there. Whenever you are giving informed consent, the informed consent should be the whole thing should be explained to the individual in their understandable language, English, Hindi, or whatever. We have to assure that they have understood everything regarding the document of informed consent. So informed consent is a process, obviously. It is a process of collaborative communication and decision making, not simply the signing of the form. Okay, we have to completely explain them the whole thing about the study, and then they have to decide that whether they want to participate in the study or not. Okay, and informed consent requires that prospective participants so we have discussed these 4 points. This is just a summary. They should be appropriately informed about the nature of research. They should have adequately understood this information and what will be its implications. They have, by their choice, decided to participate without any compulsion, and explicitly consent to participate orally or in writing is obtained. So who gives the guidelines for IRB IEC in India? So that is given by Indian Council of Medical Research. In our country, they have given specific guidelines of how to form IEC, what are the guidelines. So you can just go to the website of IECMR and you will find a lot of details regarding the ethical concerns and ethical guidelines. Whether IEC waiver is given sometimes, maybe, but that decision has to be taken by the committee only. Like I may feel that, okay, I need some very few some medical images, and the images are already stored, like for example, retrospective means I want to work on the data which is the old data. I cannot find those patients now, but the old data that is already stored in the computer. Okay, so whether I can do that, or whether still informed consent is needed, or it can be waived off, so that decision is only taken by IEC. The researcher has no role in decision making. Okay, and the main areas of focus. So this was all about the ethics in human research. But overall, when I talk about research, when I talk about publication, when I talk about doing research, so there are some other points which also comes under ethics. The first is research misconduct. Okay, misproducing false results or fabricating the results just to have publication, copying the contents of other researchers, that is plagiarism. And collaboration issues are also there. Who will be the author? Authorship has to be taken very seriously. Just someone who has corrected the grammatical errors in the paper, they may be put in the acknowledgement, means they can be author or not, that is something which is debatable. So authorship has to be taken very seriously, that who has actually contributed scientifically to the paper or to the research. Data ownership is again important thing. because in collaboration lot of issues are there. Multiple institutes are doing the same study, and if some international institute is also collaborated, then whether the data can be shared to them or not, that is again a ethical concern. And the management of everything is again a important concern, because so many institutes and so many collaborators are involved. Peer review is also important. Peer review of the document. Conflicts of interest should not be there. Means the review should not go to the person who I know or who may have the interest in publishing my article or accepting my article. Complicity and the funding resources. So animal subject research, human subject research. So obviously this animal and human already we have discussed in the last slides. Okay, and the funding sources also need this ethical approval before initiating the study or before approving your study. Okay, so these were the few things which are important while conducting any human or animal research, and also research of any kind. Also research of any kind. Why? Because we owe to public for its funding support. Whatever fund we are getting, that is, we are getting it from public. Okay, individual research participants, out of respect for their autonomy, we owe to the participants who were involved in the study. We owe to the colleagues and collaborators whose research may be based on our research, because my papers may be referred by some other researchers. So we owe to them, because that's why, so that our paper is completely genuine and so that they can move in a genuine way. Funding institution, we owe to the funding institutions because they are giving us resources, and also to the research institutions and universities in which we are working, our employers. Their reputation is dependent on our work. So that's why, so because we owe to all these, it is very important to conduct the research in ethical manner. Okay, so with this I will stop this part 1 of presentation. I hope that all of you have got a basic idea of why ethics is important, and while doing any healthcare research, because the workshop is HTTP is about healthcare. So while doing any healthcare research, it is very important that this ethical things should be taken into consideration. The approval of ethical committee should be taken into consideration before initiating such kind of study. Okay, so now I'll be talking about intelligent computing pipeline. In the last session, we have already discussed few things about intelligent computing, and we have gone through a technique also called as deep learning. Okay, but now I will be discussing a very basic fundamental, so that even the young people can easily understood that how actually the intelligent computing pipeline goes. What are the different steps of intelligent computing? Okay, so basically when I say intelligent computing, it is the ability of system to gather some knowledge from the data or experiment. Okay, so intelligence, from where this intelligence comes, that comes from learning. Okay, and when I say learning, so the techniques which generally used are machine learning and deep learning, where you just discussed about deep learning in the previous session. Okay, so let us first go with this intelligent computing pipeline, and then we'll go deeper in this particular subject that is called as machine learning. I'll just open another window. Okay, so in the intelligent computing pipeline, okay, so in the intelligent computing pipeline, the pipeline which I am discussing is after data collection. So you have taken necessary approvals from the competent authorities, including your institute and ethical approval and everything. So we have our data with us. Okay, so obviously the first step in the pipeline will be data. We need to have data collection, how many samples are required, and all those things, those calculations you have done earlier, and based on that protocol, now you have collected your data, and now on that data I want to apply intelligent computing. Okay, what can be the data? The data can be some kind of signals like EEG, ECG, EMG, any kind of data. It can be images, any medical image, CT, MRI, mammogram, ultrasound. It can be any kind of say speech So here I'm talking about biomedical signal. Okay, but then there can be text or speech also. So there can be so many different types of data. Okay, so the first step in intelligent computing pipeline is data pre-processing. Data pre-processing. It involves what? It involves noise removal, or we say denoising, noise and artifact removal. It involves data normalization. Okay, so the data which we acquire, there is a possibility that it can include lot of samples with noises. Lot of samples with noises. Like for example, if I'm recording a EEG data, while acquiring the EEG, there may be a possibility that the subject has done eye blinking or has moved his or her hand. Okay, so because of that, there will be some kind of artifact that we'll be seeing in the signal, some kind of noise we will be seeing in the signal. And already there are some standard noises also in the biomedical signals, like baseline shifting and power line interference. So I'll not discuss about that at present. It is there in the other sessions. Okay, so some noises are there and we want to remove those noise, because that noise has degraded our the quality of our signal. Okay, so noise removal is important. Data normalization. What is data normalization? Basically, because sometimes what happens, we take data from different sources. Like for example, I have taken image data, ultrasound image data from different machines, which may have slightly different specifications. Maybe the amplification factor or something may be different. So we have to normalize data. It means that we have to bring them all under the same table. Okay, in a very basic term, if I want to explain you that, suppose I have some signal, and the signal acquired from one particular machine is in the range of say 0 to 30, and other is in the range of 10 to 100, and if I want to analyze that, then the analysis will be affected, because the data is same. This is also say EEG, this is also say EEG. Okay, but the value of the second data is higher because of some specification or setting in the second instrument. So I want to bring them in the same range, say 0 to 1, the whole data in the same range, 0 to 1. Okay, so am I audible to all of you? Please, Priyanka, please call me.
Yes,
Yes,
you are
sir. You are
Yes,
audible.
if the network goes. Okay. Okay, so I want to bring all the amplitudes in the range of 0 to 1. Okay, so that the classifier performance does not get affected due to, or does not get biased to the higher valued samples. Okay, so this is called data normalization. Data normalization is done somewhere in the data processing level. Sometimes it is also done later, which I'll discuss after feature extraction. Okay, after getting this data, okay, data can be sometimes in the form of tables also, only numbers, not signals, not images, only numbers. Suppose some pathological data I have collected from hospital, which includes say some values of some blood pathology or something, that is in the form of table. So that's why this data normalization becomes important at this stage also, because the data which I have collected may have very different ranges. I want to bring them in the same range. So this is called as data normalization. After data normalization, once we have collected the data, the next, okay, one thing I missed in data pre-processing, sometimes we do improving the quality of data. Improving the quality of data is also important sometimes. Why we want to improve the quality of data? As I told you, that because, for example, in ultrasound images, there is an inherent noise called speckle noise. So a lot of inherent noises are there. I want to enhance the image. I want to make it more bright or more dark, so that the object of interest can be more clearly seen. Okay, so that also comes under pre-processing. I want to remove some outliers. Outliers means the samples whose characteristics are entirely different from the whole data set. They're called outliers. So they also needs to be removed at this data pre-processing stage. Okay, after this data pre-processing, the next step is feature extraction. The next step is feature extraction. The next step is feature extraction. Now, if you have data in form of table, feature extraction is not, will also obviously not be there, because already you have the actual values of the signal. Actual value of the, we have already the data in form of table. Okay, but for biosignal, images, speech, we need features. Now what is feature? Feature is nothing but it is a representative of that data. Like for example, if I want to say if I talk about ECG, so what can be feature, what can be important feature in ECG? So ECGs look something like this. Okay, this is called QRS complex, which is significantly very important. Okay, so what is the peak of QRS? That can be important feature. What is the width of QRS? That can be important feature. What are the peak of other small waves? PTU, that is also important feature. Okay, then there can be some other features which are not directly related to these peaks but indirectly, like area, power. So features are some numerical values that are extracted from the signal or the image. As sir was telling, it can be entropy. These are the features. So after data processing, we have extracted some features. Okay, so I'm just assuming that, just to give you the idea, I'm assuming that I have total of 200 images, say of lung cancer. Okay, and out of these 200 images, I have say 100 of benign. Benign means it is not cancer. Okay, and 100 corresponds to malignant. Malignant means it is cancer. So two types of images I have, both include some suspicious area. Okay, they are divided into two groups, 100 with benign and 100 with malignant. I have pre-processed it, removed some noise from it, and after that now I have to extract features. When I'm extracting features, say I extract 20 features from these images. We can extract thousands of features, okay? But suppose I'm extracting only 20 features from them. So what will be my size here now? 200 into 20. The size of my table will now become 200 into 20. 200 rows will be there. 20 columns will be there. Okay. And this will be my new size of data. I hope it is clear to you. Okay. These are called, so features can be any characteristics of the image. It can be related to boundary, it can be related to internal texture of the image. So lot of features are there which are available in literature. After extracting features, the next step is feature selection. The next step is feature selection. There may be a possibility that the 20 features which I have extracted, some of them may be redundant. Some of them may be, so reduce redundancy. Redundancy. Reduce redundancy. I don't want all the features. Some redundant features may be eliminated. Okay. So, like for example, if I want to classify apple with orange, so the shape may not be good feature because the shape of both almost is same. Both are like circular or oval in nature, circular in nature. So some features may be redundant, they need to be eliminated. So that is done with the help of feature selection. Sometimes along with feature selection, instead of feature selection, researchers do statistical significance analysis. Statistical significance analysis, like they will apply t-test or Mann-Whitney U-test. Lot of tests are there. Mann-Whitney U-test. Lot of tests are. So they apply the test and then they get the information that okay, from this 20, only 10 features are important. So we take those 10 features. We took those 10 features. Now in this 10 features, now in this feature selection which I was just discussing, feature selection, there are two main methods. One is called filter method and other is called wrapper method. Two types of methods are there. We have one filter method and we have one is wrapper method. Now suppose we have 20 features, as we discussed here, that how many features we extracted? We extracted total 20 features. So what filter method will do, in filter method what happens, every feature is given some rank. Every feature is given some rank based on some predefined criteria. Like for example, in a class of say 60 students, if I want to find best 10 students, so what I will do, I will take some criteria. I'll take their percentage of marks in the last examination, or I'll see, okay, who the students who are good in sports, I'll use some ranking criteria. Okay, like here also some ranking criteria are, for example, information gain. Electronics people might be knowing this, information gain. This is one criteria. So so don't think about these criteria too much here. So based on some predefined criteria, each feature is given a ranking. Okay, like for example, F1 gives 10th rank, F2 gives 5th rank, F3 gives some rank 15. And after this ranking, we take top 10 or top 5 features, whatever we want. This is called filter method. In wrapper method, the scenario is something different. Instead of ranking all the features, a best group of features is selected. From F1 to F20, I will not rank which feature is good or which feature is first or which feature is second or which feature is third. That will not be done. Instead, I'll try to find which group of features gives the best performance. It may happen in a class of students, as I give the example. Suppose I want best group of students who are good in everything. So I may take some students with good CPI, some with sports or like, so I am interested in group, not an individual. Okay, so how that group is formed? So suppose I start with F1, I combine F1 with F2 and find the performance, say accuracy of my classifier. Okay. Obviously, I will start with F1 first. For F1, I will calculate the accuracy. Then I'll combine F2. If accuracy increases, I'll keep F2. Otherwise, I will remove F2. Then I will add F3 to the group. I will again calculate accuracy. Suppose the accuracy decreases. So F3 has to be eliminated. The next step may what will go? F1, F2 will go. F4 will be added. F3 is eliminated because after adding F3, the accuracy decreased. Okay, this is in this way, this wrapper method is continued, and finally we get the best group of features. Okay, and remember that this after this process, the same process is started with F2 also. F2 also, then F3 also, F4 also. So this is computationally expensive. A lot of time is required in wrapper method. But you get the best subset. Here, the time is less, but there is one problem, that how to decide top 5 or top 10 or top 15. So a lot of experiments further are required to decide exactly top how much. That is a problem with filter method, but both are used sometimes. Sometimes combination of both are also used. Okay. This is what is called as feature selection. After feature selection, suppose I have selected only 10 features. So now my new data size will be what? New data size will be now 200 into 10, because earlier there were 20 features. I have eliminated 10 redundant features. So I am having now only 10 features remaining with me. So my new data size will be 200 into 10. Now I will go for data division for training and testing. Data division for training and testing, which we were discussing in the previous session, 5-fold, 10-fold and Some other methods are there. So I'll just discuss briefly those. Data division. So the first type is holdout. In holdout, what happens? If I say 33% holdout, which is most acceptable in research community, it means that the remaining 67% of the data will be used for training of the model, and the 33% of the samples will be used for testing. After this feature selection, now what we have to do? We have to build our classifier model. It can be deep learning model, or it can be machine learning model. It can be any model. Okay, so we have to now develop our model. For model, we need data to train the model. To train, we cannot use the whole data to train only, because later on we want to test also. So how to divide the data into training and testing? So some rules are there. So this was the first rule, holdout, 67% training and 33% testing. But there is one problem with this rule, because this is completely done randomly. Okay, so what happens? Randomly 67% data will come in training, and like for example, in a class of 100 students, if I want to select appropriate students for training my model, randomly, if I select randomly, there may be a possibility that some unusual sample does not come in 67%, which I wanted to give to the model for training. Okay, so what I'm saying is that the model should be trained with all types of sample, good samples, bad samples, and in this random division of 67 and 33, there may be, sometimes it may happen that, okay, the 67% samples which I am taking for training, all are good samples, or 33% which I am taking for testing, all are very bad samples. They are actually outliers. That may happen. Okay, so that's why one problem to solve this is to repeat it multiple times. Repeat the whole process multiple times, say 10 times or 100 times. But then also there is a possibility that some samples will never come in training or never come in testing, because the process is done randomly. Okay, so to do this, the other method is k-fold cross-validation. K-fold cross-validation. Generally, we take 5-fold or 10-fold. What we do in this is, the whole data set, like in our case, we had 200 data sets, right? 200 samples, 10 features. So the 200 samples will be divided into 10 groups. When I use 10-fold, it will be divided into 10 groups: G1, G2, G3, G4, G9 and G10. Okay, and each group will have how many samples? 20, because total number of samples are 200. So what is done in 10? So 10-fold simply means that we divide it into 10 groups. And then what we will do, what will be done, out of these 10 groups, k minus 1. K minus 1 means 9 groups are used for training, and the last group is used for testing. So G1 to G9 training, G10 testing. In the next round, G1 to G8 and G10 will be used for training, and G9 will go in test. So once G1 will also go in test, all remaining in train, G2 will go in test, all remaining in train. So this method assures that the model should be trained with all the samples and the model is tested with all the samples. That's why k-fold cross-validation is the most accepted data division protocol by research community. I hope you, if I take 5-fold, then the data set will be divided into 5-fold. Each fold will be once come in testing and the remaining will go in training, and it will run 5 times. 10-fold will run 10 times. And finally, the third method is called leave one out data division protocol. This is generally used when you have very low number of samples. And what is done here is that, suppose I have say 20 samples. S1, S2, only 20 samples. So leave one out is actually a special case of k-fold only. It is a special case of k-fold only with k equal to 1. Just assume that k equal to 1. So what will happen? S1 will go for test, remaining will go for train. Then S2 will go for test, remaining will go for train. So we are taking one out. We are taking one out, the rest of them go to training, and one out will go for testing. This is very time consuming if number of samples are more. That's why k-fold cross validation are the most preferred type of data division protocol, which is used in training and testing. Okay, so after this step, after data division, we get two groups of data. One is train and other is someone wants to ask something. I'm getting some noise. So the data is divided into two groups, train and test. Okay, the training data is then used to train the model. Now what is model here? Model is some program which may be artificial neural network or support vector machine or some other network deep learning model which I have already designed. We have designed the algorithm. Okay, so that model now needs to be trained. Okay, and once it is trained, once it has learned, training means what? It has actually learned now. So once it has learned, now I will test the model, and after testing I will evaluate it, and then I will report, okay, when I reported it using the test data, I got 80% accuracy or 90% accuracy or that. So the last step is evaluation, that I'll discuss later on in the coming slides. Okay, so this is the basic pipeline of intelligent computing. I hope you are clear with this. In any intelligent computing task, you will be using either all these steps or some of these steps, depending upon your input data. Depending upon your input data. If input data is directly in the form of table, I will start directly from statistical analysis or feature selection. I will not do feature extraction. Okay, so most of these steps or all these steps or most of these steps are used in any intelligent computing pipeline, any application. Okay, now coming to my slides.
Sir, can I interrupt?
Yeah, please.
Sir, in this way, all data is tested and training also, right,
Yes,
sir?
yes, correct.
Okay.
Yes. So that is the main purpose of using k-fold cross validation. We want to train train using all the data and test using all the data, but not at the same time. Okay, not at the same
Okay.
time. We are training with some samples and testing with some other samples in the round one. In the round two, we are training with some different samples and testing with different samples.
Okay, but finally all data is
Right,
tested, right, sir?
right.
Thank you,
Correct.
sir.
Yeah. Okay. So what is okay? So there is one more method which I did of data division which I did not discuss because that is not used now. That is called resubstitution method. Earlier it was used. The whole data at once is used for training, and the whole data at the same time is used for testing. But it is not used because that introduces a lot of biasness. It is similar to giving exactly same numericals in the exam which you have taught in the class. That is resubstitution. Okay, so that is not used now. So now I'll be talking about some techniques because now we have studied the intelligent computing pipeline. Okay, and I just told you before starting that intelligent computing. So intelligent here means what? It means learning, and learning from where it is related to what? Machine learning and deep learning. So you have studied deep learning already in the previous session. Deep learning is generally used, or deep learning is obviously a very useful tool, but still machine learning also is used by in many studies because when the data is huge, deep learning works good. But if the data is small, sometimes machine learning also performs well. And if with small data, if machine learning performs well, then using highly computational requirement deep learning may not be good. Okay, so in other way, I can say that machine learning forms the fundamental of deep learning. So that's why it's also important to study machine learning. Okay, so I'll discuss some concepts bit fastly because already they are told in the previous session, and we have a limited, we have half an hour left, I think. So what is the difference between traditional programming and machine learning? Okay, so in traditional programming, what happens? We give data and program to the computer and we get output. Okay, so there is some program related to addition, subtraction, or whatever, maybe some controlling program, controlling temperature or something, whatever. So that program is there in the computer. We give data, we get output. The computer is not learning anything. Okay, so the problem is given, and the solution, you'll get the solution for the previously known problems, but for new problem the solution is not available. Okay, in traditional programming. In machine learning, what we do, we don't give any data in prior. We make a program to learn. We make a program to learn, and then we give the data so that the machine can learn. And now, because machine has already learned, we give new problem or we give new data and we get the solution based on this learning. Okay, so why these techniques are required? Because there is a huge data set. And manually it is very difficult to analyze them. Why we need intelligent computing in healthcare? This is the main reason. The doctor to patient ratio is so less. Means the doctors are very less and patients are very high, and so many analyzing so many images, so many signals, so much of pathological data manually is very difficult. The computing AI, intelligent computing AI, they cannot replace doctors. They are developed to reduce their burden. They are developed to assist them. That is the main objective. Okay, at least I'm talking about up to current scenario. It cannot replace doctors. They can assist them. Okay, so to analyze this huge data, it is manually difficult. So we need what? We need computers. Okay, so machine learning, it is a domain of artificial intelligence. It is a subdomain of artificial intelligence that helps computer to learn based on the program and adapt on their own without being explicitly programmed. Means we are not explicitly programming it. It means that we are not programming it for something very specific. We train them to learn. We train them to learn and adapt according to the new data, according to the training data. Okay, and machine learning algorithms learn a pattern from inputs, and after learning they predict and perform desired tasks slowly based on the learned pattern. Okay, as sir was telling that, Rodin sir was also giving some example that a child who is not taught to talk in English will never be able to talk in English. So that's why learning is important. So we develop algorithms so that the computer can learn. Learning is important. Okay, and the computer should be able to solve linear and non-linear problems, linearly separable and non-linearly separable problems. Okay, most of the real-time problems are non-linearly separable. What does it mean? Linearly separable means, suppose we were talking about lung images, right? Lung images, benign and malignant. So suppose I have extracted some features like area of the tumor. Okay, and this is the amplitude of the area, value of the area rather. I should not say amplitude, it is value of area. Okay, and suppose for benign, the area is small. So suppose it comes here. And for malignant, the area is high. So it comes in the higher side. So we can easily separate them using a linear line, a straight line. Such type of problems are called linearly separable problems. Okay, but there are certain situations, maybe there may be a situation where we will find that it is actually not like this. It is, okay, this I should have used some different symbol, cross or something. Okay, so suppose we have something like this. the classes are mixed. The straight line cannot be made. So what we'll have to do? We have to make something like this, a curved line. This is called non-linearly separable problem, which are difficult, Okay. So machine learning, deep learning, they are able to solve even such kind of non-linearly separable problems also. Okay. What are the types of machine learning? There are three types. We have already discussed it, so I'll not discuss it in detail. Supervised learning means we give images, like for example, I'll try to explain it in a very basic manner. I have given a question paper to a student. That is not exam, that is just to train him, and along with the question paper I have also given the answers, and student tries to find the solution based on the answers which I have given. That is called supervised learning. In unsupervised learning, we give some samples to the machine, like I give apples, I give oranges, I give banana. I have mixed them and I have given to the machine. I'm not telling the machine that this is the apple, this is the orange, and this is banana, as we do in supervised learning. Here, we have just given the data to the machine. The machine itself analyzes it by using some characteristics, say color or shape, and then characterizes them into different groups. Characterizes it into different groups. That is called as unsupervised learning. In unsupervised learning, training is in the training data, the label is not given. Label means class. Label means what? Label means class. In supervised learning, you have given the question as well as answer. So answer is the label. In the example which we just discussed earlier, 100 images were benign, 100 were malignant. So we were knowing which is malignant and which is benign. For every image, we were knowing that this is benign and this is malignant. That benign malignant is the label. That is very important in health research. If the label is not known, we used unsupervised learning. So what unsupervised learning will do? It will extract some features from the images, and based on those features, the unsupervised learning will tell, okay, these images are of one group, these images are of other group. But model will not tell you this is benign and this is malignant, because we have not given any labels. And the third type is reinforcement learning, where it is also called semi-supervised learning. Reinforcement is also semi-supervised. In semi-supervised, what is done is that some kind of the model is not given information about the label, but whatever model does, like for example, you see in this figure that we have a agent. Okay, when agent comes to fire, so the agent was not informed earlier that fire is dangerous. Agent was not informed earlier. Okay, but when the agent touched the fire, so the agent felt, okay, this is dangerous. Okay, so some score is given to the agent. Like here, the score that is given is -50, because you did something wrong. You should not do it in future. Okay. Okay, so the model now learns that next time avoid it, because this fire is bad. So what happens in reinforcement is that whatever model does, some kind of reward or punishment is given to the model, and accordingly model learns. This is called reinforcement learn. These are the three types of learning. Okay, so now we have already discussed about machine learning pipeline. I'll be now more specific about the images. I think this I can skip at present because we have limited time. It is actually the same thing. I'll just discuss it in very brief. So when you do medical imaging or medical image processing, the first step is image acquisition, that is data collection. After that, we want to improve the quality. We want to do pre-processing. We just studied in the pipeline that we need to improve the quality of the image. So we can do enhancement. Like this is a low contrast image. This is a high contrast. Contrast is not related to darkness or brightness. Contrast means in which image is more visible. Okay, so the second step is enhancement. The third step is segmentation. If I want to analyze only lung region, Then this is a complete chest X-ray image. This is a segmented chest. I want to analyze only these regions. Okay, chest portions. So I will only segment those portions. If in a image, if in a breast ultrasound image some tumor is there, I want to extract only this region. This is called segmentation. Feature extraction I have already discussed. I will not discuss here. Feature selection we have discussed, and classification also I have discussed. Okay, so I'll not discuss these things. I'll go further. There is another term called as regression. Regression. Classification means to tell either benign or malignant. Means we have some classes, yes or no, normal or disease. That is called classification. Regression is something different. In regression, we predict that this will be the output. Like for example, based on the student's profile, whether the student comes from rural area or urban area, whether he has studied in some good school or maybe some reputed school or not much reputed school, what is his family background, how are their parents, whether they are educated or not. So based on certain parameters, we predict that the student may pass or fail. This is called regression. Okay, so now in brief, I'll try to discuss two techniques in very fast manner because we have limited time, but I want you to understand that we have just studied about deep learning. Okay, but the foundation of deep learning comes from artificial neural network. Many of you might be knowing this technique, but maybe some participants need this explanation. So what is this artificial neural network? Deep artificial neural network is deep learning. Okay, deep artificial neural network, when the number of layers are increased to a very large value, it becomes deep learning. Okay, so artificial neural network is inspired from biological neuron. Artificial neural network is inspired from biological neuron. This is a figure for biological neuron. In this figure, you can see that this is a cell body. This is a cell body. By arrow, you can see. And cell body, so neuron includes what? So our brain includes what? Lots of neurons. So you can assume that this is a single neuron. And all the neurons are massively parallelly connected to each other. Every neuron is connected to every other neuron. Okay. So artificial neuron is inspired from this fact that, so this is the figure of single neuron, okay, and the neuron acts as a summing junction. So every cell body acts as a summing junction. It sums all the inputs receives from different neurons. Okay, and there is something called as dendrite. These are the dendrites. Dendrites are, you can say, the channels through which signal is received from other neurons. Okay, so what happens? So so we have a cell body and signals are received from other neurons. Each signal will have some strength, some will have high strength, some will have low strength. And depending upon the overall sum of all these signals, the neuron gets fired or not fired. Fired means you react accordingly, and not fired means you ignored. You ignore because your neurons didn't get fired. The information from one neuron to other neuron is transferred through axons. Means these axon terminals, they are connected to dendrites of another neuron. They are connected to, these are the axon terminals, and the axon terminals of one neuron are connected to the dendrites of other neuron. Okay, so in this way, this biological neuron works, and this is the replication of biological neural network, and it is called artificial neuron. So you see, X1, X2, X3, X4 are the inputs. So these inputs are what we, in the pipeline which we studied, we had 20 features. Do you remember? Out of 20, we selected 10 features. So these are the input features. These are the input features: X1, X2, X3, X4. In our explanation, please mute your mic. Priyanka, please. Priyanka, please see whose mic is not muted.
All the participants, kindly mute yourself.
Can you see who is unmuted?
Yes, sir. So Vinod Kumar, someone is there.
Vinod Kumar, Vinod Kumar, Vinod Kumar, please mute your mic. Can you mute Priyanka if from your side? Please see.
I'm not able to do it from my side. I'm just trying.
You can ask madam otherwise. Maybe she can mute.
Yes, sir. Yes.
Okay, so I was talking about this is a lot of disturbance.
पाठवले फोटो पण ते शेवटचे 2 क्वेश्चन का पूर्ण 18 क्वेश्चन.
Okay, so these x1, x2, x3, x4 are the information. How I'll be taking this noise is too much. X1, X2, X3, X4 are the inputs that are received from the dendrites. Okay, these dendrites. And these are nothing but the features which we extracted, 20 features. So there will be 20 and we selected 10. So there will be X1, X2 up to 10. Okay. And these are their strengths, which are called weights here, synaptic weights. WK1, WK2, WK3, WK4. Okay. And this is the cell body, which is adding all the inputs. Okay. And depending upon the... Priyanka, please look into this.
आणि मग मला ते मॅडमचा नंबर पाठव बरं. कोणती मॅडम आहे?
Mridu ma'am is there?
काय नाव आहे मॅडमचं? पाठव मला.
I think organizers can mute.
Yeah, I think the main login is at Dr. Mridu or Priyanka maybe. Please mute Priyanka.
Yeah.
You can mute, I think. Let me check. Actually, I'll have to invert my laptop. Just a minute.
Only admin can mute it.
मोहिनी मॅडमचा नंबर तुझ्याकडे का?
Vinod Kumar.
तू घरी होती का आता?
I cannot mute. I
दोन
tried.
क्वेश्चन बाकी होते ना?
Only organizers
18 बघे पण बाकी होते ना?
Priyanka, can't you do?
It's not from my side. I've asked Mridu ma'am to do so. So ma'am have done it and he has again unmuted himself.
मॅडमचा नंबर दिला फोन.
Vinod Kumar Ramesh Patil. Vinod Kumar Ramesh Patil, are you there?
अच्छा का बोल करता बघतो.
He is not even bothered about that. Vinod Kumar Ramesh Patil, are you there? Vinod Kumar Ramesh Patil, are you there? Sorry for this disturbance. Okay, so we were talking about this artificial neural network. Okay, and so I was talking that these are the inputs, these are the weights, and this is the cell body which adds everything. Okay, and then they are passed through some activation function. So why this activation function is required? Because after summation, whatever value is obtained, that is Vk, whether that is sufficient to fire a neuron or not, that is decided by this activation function. It is some threshold kind of thing. You can say that, okay, if the value of Vk is above this, the firing will be done, otherwise the firing will not be done. Okay, so this is the artificial neural network. Okay, so mathematically, how the whole process of learning is done. First, I'll just so these are some examples of transfer functions. This is a step function. In a step function, if the output is greater than 0, the neuron gets fired. It means that output is 1. If it is less than 0, the neuron does not get fired. So similarly, we have different equation. There is this step function is also called hard limb function. Okay, so I'll skip this part. Rather, because today we don't had this hands-on, so I'll just try to explain you one problem, so that these steps are already covered in that. Okay, so I'll just go to that numerical problem, and okay. So from this, all the slides which I have skipped will be covered. So don't worry about that. Okay. So ANN working example. I hope you all know now what is ANN. ANN is nothing, but it is a machine learning model which is inspired from the biological neuron. And how the things now go, let us try to understand that. So see here, we have 4 samples, P1, P2, sorry, 3 samples, P1, P2, P3. Like in our example, we had 200 samples. But to understand the concept, I have taken only 3 samples, P1, P2, P3. How many features are there? 2 features, F1, F2. What are the values of that? 1, 2 for first, -1, 2 for second, 0, -1 for third. And what is the label? Label means class, benign or malignant. What is the label here? Either 1 or 0. So the label for first sample is 1, the label for second sample is 0, and the label of third sample is 0. So it means that we have 3 samples, 2 corresponding to 0 label and 1 corresponding to 1 label. Okay, this can be plotted like this. The first label is how much? The value of first sample is 1, 2. So this is x-axis, this is y-axis, or you can say F1 and F2. So value of F1 is how much? 1, and F2 is how much? 2. So here I can put first class, first label. This is T1 equal to 1. In second case, it is -1, 2. In the second case, so this will be -1. I hope you all understand this. And Y is 2. So because it is a 0 class, I have not filled the bubble. Unfilled bubble means 0 class. Filled bubble means 1 class. The third feature value is 0 and -1. So this is the value for 0 and -1. Okay. So in this way we can plot this, and this is the neural network diagram. How many features? How many inputs? We have 2 features, right? P1, P2. We can write it in F1, F2 actually. They'll have some weight or strength, W. They will be added. I'll get some output that will be passed through some transfer function. Then I will get the actual output, model output. In this way, we design it. Okay, just a minute, madam is calling. Hello. Madam, I will stop now. In 5-10 minutes, I will stop. Okay. I will tell them. Okay, thank you. Okay, so now after this example, I will end here. I'll give you one more example in my second class. I have another session in the maybe day 2 or day 3. I think I'll give the next example in that class. Okay, so what we do, we first initialize the weight in the actual manner. In the actual program, the program is written such that the value of W11 and W2 is initially taken randomly. Okay, so what value is taken here? 1 and -0.8. Okay, I think I should stop here and rather clearing doubts. I will take both the examples today if time permits, after the next session or in the next session. Otherwise it will go hurry, and I don't want to take a chance that some of you don't get understand it. So I'll take this in next class. Do you all agree to this? Because there are some questions also. Okay.
Yes, sir.
Okay, sir.
I'll solve some numericals related to intelligent computing, so you'll get a better concept of that. Okay.
Participants.
Right, sir.
Okay. So some questions are there or not? Okay, some questions are there. Okay. So in real life problems,
yes, some questions are there.
Yeah, I can read that. So let me answer. So in real life problems, most of the data in the format of linear or non-linear. So it is non-linear. Most of the all the real-time data is non-linear, not linear. Okay.
Okay,
Yeah.
okay, sir.
Could you please suggest? Yeah. What is for reduplication? I have not worked in this area, but what I feel is that I think most of the machine learning techniques can be used. You have to just see that how they will be applied. Okay, data reduplication is a different field. We have not worked in it, but I think two machine learning techniques I'll be discussing with you, complete numerical with numerical example. So I think you can apply those techniques also. I'm not sure about that because we have not worked in this data reduplication. What is this Q learning? Explain what is the purpose of using Q learning. Vinod Kumar Natrajan. What do you mean by Q learning here? Are you there, Mr. Vinod? Okay, so I think he is not there. Any other questions from you all?
Sir?
Yes.
Sir, actually, this session is very informative to all participants. It's a wonderful session and lot of mathematics involving in your presentation also, sir. Right, sir?
Yeah,
Yeah, sir, I am from the mathematics background, and and definitely this intelligent computing is interdisciplinary field, and this field is new for me. But from your lecture, I have got some confidence, sir. So, can you, if possible, sir, can you share this presentation with us, sir?
We will be sharing all the presentations.
Okay. It's thank you very much, sir.
Okay. And
okay, thank you.
Yeah, and in many faculty in our institute who are from mathematics, they are applying intelligent techniques in their research area.
Okay. It's, yeah, right, sir. Even though I will try to contribute something in this intelligent computing, sir, from my background.
Yes,
okay,
yes.
Thank you.
All the best.
Very much.
Okay, output of yeah.
Sir, I'm Nagasindhu, sir.
Yes,
sir. In the previous diagram that you have shown, the output of reinforcement learning will be used in Markov decision and Q learning. That's why some faculty asked about Q learning. I do have the same doubt, sir.
Okay. Yeah, madam, the two methods, that is Markov and Q learning, they are actually the techniques in which reinforcement learning is used. Ultimately, this is the this reinforcement learning is also a method of training the model. So output ultimately will be same. Output ultimately either you will use it for classification or regression. So output you will get the output similar in case of what you will get in supervised or unsupervised classification, but the method of learning is different. So these three are the methods of learning. And in the right side, I named some techniques. So they are actually the techniques in which this kind of learning are used. Yeah. So these are. Did you get this point? So these are some techniques. Yeah. So like SVM, neural network, naive Bayes, these are techniques which uses supervised learning. These are the techniques which uses unsupervised learning, and Markov decision process and Q learning are the techniques which uses reinforcement learning. So these are the name of techniques which uses these kind of learning, and the output will remain same, because ultimately what you want to do, you want to either classify or you want to either predict. So what we discussed in classification or prediction, output will be like that only. Is it clear now, madam?
Sir, I have studied one paper like this, sir. Nowadays, they are using much about the advancement of Q learning. So, what's the advantage in that when compared to other methods, sir?
Madam, actually, you'll see advanced means lot of paper even in new types of SVM and deep learning and neural network. So for all these topics, you will see that people are still working, they are modifying, they are improving its performance. Okay, but as you can see that this reinforcement learning, that is Markov, and they can handle some special circumstances where label is not directly available, but some information is available that whether the model is trained correctly or not. So some criteria is available to determine that whether the model is correctly learning or not. So in such situations, when you have data, label is not there, but you have some information that, okay, the learning should go in this manner. So in that case, reinforcement learning can be used. So
Yes, sir. Thank you so much,
there is
sir.
nothing like, yeah, there is nothing like advantage. Every new technique will have some advantage over the previous one. So it will be like that only. Okay, madam?
Thank you for taking time and giving answers, sir. Thank you so
Okay,
much.
ma'am. Okay.
Yes.
Any other questions? Okay, so I think we can end the session now. I'm there with you for the whole all the 5 days. So if you have any other question, you can also message me or email me. No issue in that. Okay, my email will be there, I think, in the brochure. If it is not there, you can see in the website of NIT Raipur. You will get email IDs of all internal people. Okay, thank you very much. So I think we'll have break for lunch. Priyanka?
Yes, sir.
Thank
So
you, sir.
right now we are having break for lunch. Thank you for your session. And sir, all the participants are requested to come back at 3 p.m. We are having another session from that time. So for today, we are giving a less break to you all. So you all please gather at 3 p.m. Thank you.
लंच ब्रेक मॅडम आता लंच ब्रेक लागेल
Where ATAL unique FDP, unique ID? Ma'am?
Ma'am.
Ma'am, may I know where can I get the ATAL unique ID?
What ID you want, ma'am?
Yes, ma'am. Yes, ma'am.
What ID you want?
Somewhere in the feedback session, I have seen ATAL unique FDP ID.
It is shared in your WhatsApp group. Or you can check your email also. It is shared there also.
Thank you so much, ma'am.
Okay.